Let's think about our morning routine. Wake up, we make the bed, we brush our teeth, we change our clothes, we make some breakfast, and then we head out the door for the day. Now, everyone may have a slightly different routine in a slightly different order, but there is one commonality amongst the majority of individuals, and that is walking. In order to complete our morning routine, we walk around the house. However, for thousands of individuals with a spinal cord injury, this movement is either reduced or completely lost due to signals from the brain not being able to reach the leg muscles. Currently, these individuals use an implanted system that stimulates the nerves and activates the otherwise paralyzed muscles to generate steps. Unfortunately, though, this system not only requires an excessive amount of upper body effort to remain stable, but results in abnormal walking, since it's unable to correct for errors that may occur, which make it quite challenging to complete daily tasks in and out of the house without the use of a wheelchair. For my dissertation, I'll be focusing on improving walking after a spinal cord injury and reducing that upper body effort by changing the stimulation levels that are being sent to the nerves to correct for the errors that may occur during the walking cycle. To improve this walking, I'll be attempting to make a controller with updated command system that will use sensor signals to communicate with the current implant system to tell it how much of that stimulation levels to change and when. So to think about how this controller works, let's imagine we're making a chowder. First is the recipe. Based on previous cooking, we know how to make that perfect chowder for a cold day. Similar to a recipe, my controller will use predetermined stimulation patterns that will be sending to the nerves to activate the muscles based on able body walking. Next, with this recipe, we'll begin to mix and add in all the ingredients together. But as we do so, we're going to do some taste testing in order to make sure we're on the right track. Similar to our tongue has taste sensors, I'll be placing different sensors on the body in order to determine how the body is progressing through the walking cycle. Now, what happens if we accidentally pour too much milk into the bowl? Well, when we go to taste test it, we realize we're no longer on the right track to make that perfect chowder. So what can we do? Well, we can correct for our error by changing the recipe slightly by adding some more flour in, for instance. In the case of my controller, if the body starts to deviate away from that ideal position, for instance, they start to become unstable, then the sensors will pick up on this and notify the controller to change some of the stimulation levels to where it's activating some leg muscles more and activating some leg muscles less in order to get the individual back on track. By developing this controller with an updated command system, we'll hopefully be able to help improve walking for individuals with after a spinal cord injury and allow these individuals to walk while completing their daily tasks, such as their morning routine.